I know you hear me say it a lot. We all love to look and feel our best. But at some point in our lives, it seems that we all have that dreaded double chin. Well, what can we do about it? There's so many different options these days. You will be amazed. And joining me right now is Dr. McGovern, our coastal expert from Renewal MD. Hi, Dr. McGovern. It's great to see you.
Great to see you too.
So when it comes to that double chin, you know, of course, we know it used to be all about having surgery to deal with that. But now there's so many different options. But a lot of people still want that surgical procedure like liposuction. Is that still the primary option?
It is still a great option, and liposuction works. The type of lipo that I do is called Vaser liposuction. I put an ultrasound probe in first, and we break up the fat and we stimulate the skin to retract, and then we suck out the fat. The downside to it is you have to go to sleep, and you need to wear a binder for a couple of weeks afterwards and that kind of thing. So there's some downtime associated with it, and it's surgery. You have to go to sleep for it so that you are comfortable through the procedure. Now we have several different non-surgical options.
Well, that's what I was going to say, because you know we all live in a fast-paced society. We're going to work. We don't want anything to slow us down. So there are some non-invasive options. I've been reading a lot or seeing a lot of advertising about Cabela.
Okay.
What exactly is Cabela and how does that work?
Cabela is injected into the tissues, and it helps stimulate the involution of the fat. It breaks up the fat, and it does it's a non-surgical procedure. You don't have to go to sleep for it. It burns a little bit when you do it. It's not terrible. There is some swelling associated afterwards, and it typically is a multi-step process. So we do the injection, 4 to 6 weeks later we do another injection, and 4 to 6 weeks later we might need to do another injection, that kind of thing. It's very useful when patients have dense fat. If it's nice and loose, some of the other things we'll talk about might be better options. Some patients need a little bit of both. We'll do Cabela and then maybe do some sculpture once we've loosened things up.
And now that you mentioned sculpture, now that is another non-invasive procedure.
Right.
So you can put these two procedures together, but how do they differ?
Sculpture we've been doing on the body for a good while. More recently we've gotten the ability to do sculpture to the submental area, this area underneath the chin. We apply the device. You're in a little fabulous glamorous headgear for 25 minutes. It only takes 25 minutes to do each session, but we apply the thing. It's delivering laser energy, so it cycles back and forth between heat and cold, and you have it on there. There's a little bit of swelling after that as well, usually a little bit less than Cabela, but there's some swelling afterwards. And we typically, when we're just doing sculpture, we're typically doing 2 treatments about 6 weeks apart.
So the last time you were on the show, we talked a lot about the benefits of oral therapy. Now, what about that? Is that something that could be beneficial when it comes to eliminating the double chin?
Definitely it's helpful. I would say by itself, when patients have a mild amount of fat down here, one of the treatment heads we use is very useful for shrinking that fat. Mostly what Ulthera is for is lifting and tightening globally. So it's not going to, by itself, if somebody truly has a double chin, Ulthera by itself may not eliminate all of it, but we're lifting and tightening all the zones that we do. We do get some volume reduction there. So again, that might be a patient, somebody who has some extra fullness there. We can combine it with some of these other things and get the global look that we're really going for.
This time of year, of course, we're going into the summer months, and we're going to be right in the middle of summer. So is this a good time to do this type of procedure?
It's always a good time.
It's always a good time.
It kind of depends on how much downtime can you tolerate. You're going to, with any of these procedures, anything that delivers enough energy to make a difference delivers enough energy that you might have some swelling. I always tell patients, don't do it right before a party, unless it's Ulthera. That's all delayed gratification. So Ulthera is very subtle in its downtime. You might have a little pinkness that you need to put makeup on for a day or 2. But the other ones, you're going to have some swelling. Don't do it before a party unless it's Halloween. But it's delayed gratification. So you're going to see changes over weeks to months after the procedure and just gradually look better.
Well, and here's the thing to all of our viewers, that's why you want to make sure that if you are having a cosmetic procedure, and there's so many different options that are surgical and also non-invasive, you definitely want to make sure that you're dealing with the expert, and that's why our experts are Renewal MD. Thanks so much, Dr. McGovern. It's always great to see you.
Nice to be here. Thank you.
If you'd like more information on Renewal MD or any of our coastal experts, just check out our Coastal Experts page. You'll find that at wsav.com.